Assalamu alaikum and good evening to all students. So today we're going to have a lecture on the triangle of the neck. Um, Welcome back to the musculoskeletal block. I know that you all have a long break, long holiday, but now we need to focus back to our. You all need to focus back to your study. So for the today's topic is regarding the triangles of the neck. Okay, so for the introduction part, what is the neck actually? So neck is the transitional area that located between the base of cranium. The base of cranium is located superiorly, and the clavicle is located inferiorly. So it's like a transitional area between the cranium and also the clavicle. And what is the function of the neck? It joins the head to the trunk and also the limbs. So that is the function of the neck. And then the other function of the neck is to serve as a major conduit for the structure. Okay, it's also serve as a major channel for the structure to pass between it. There are several important organs with unique functions are located here. That's why the neck is a vulnerable vulnerable area where if there is an injury that involves the neck, it can cause trouble or problem to the persons because we have important organs that present in the neck. And the neck also is known as a region of vulnerability because here we have a few important structure that we're going to discuss later. Before that, before we go further, we're going to discuss on the bone that presence in the neck. So what are the bone that presents in the neck? So these are the bone that present in the neck. The cervical vertebra. We have 7 cervical vertebra. And then we also have the hyoid bone. Beside that, we also have the manubrium of the sternum. So these are the bone of the neck. Okay, if you see here, this is the hyoid bone, and this is the cervical vertebra, and this is the manubrium of the sternum. And beside that, the clavicle also belong to the bones of the neck. So we have 2 clavicle on the right and also on the left. Okay, we start to discuss on the cervical vertebra first. So basically, just now I have mentioned that there are 7 cervical vertebrae. The total number of cervical vertebrae is 7 in number. So we have 2 different type of cervical vertebra, which is the atypical cervical vertebra and also the typical cervical vertebra. For the atypical cervical vertebra, C1, C2, and C7 is belong to the atypical cervical vertebra. For the C3 to C6, okay, if you see from this picture, you can see this is the C3, C4, C5, and C6. This cervical vertebra is belong to the typical type of cervical vertebra. Okay, what are the features of the typical cervical vertebra? These are the features of the typical cervical vertebra. For the body, it has small and wider, it has small wider from side to side than anterior posteriorly. And it also has concave superior surface and convex inferior surface. So this is the feature of the body of the typical cervical vertebra. Okay, so it has small and wider from side to side. So mean that from side to side, it is wider compared to the anterior posteriorly. Okay. Okay, for the vertebral foramen, it is large and triangular in shape. And the other features of typical cervical vertebra, for the transverse process, the transverse foramina, it transmit the vertebral arteries, except the C7. So you have to remember that the C7 does not transmit the vertebral artery because it does not have a transverse foramina. And also, there are anterior and posterior tubercle that present on the transverse process of the typical cervical vertebra. So these are the features of the transverse process of typical cervical vertebra. And the other the other features of the typical cervical vertebra, for the articular process, the superior facet is directed supero-posteriorly. Inferior facet is directed infero-anteriorly. And the spinous process for the typical cervical vertebra, it has a short spinous process and bifid. We see here, this is the spinous process of the typical cervical vertebra. It is short and bifid. Okay. So, and then the other features that I have mentioned early, where the side by side is wider. So if you see here, side by side is wider compared to the anterior posterior. Okay, for the body. And then for the superior articular processes is directed supro-posteriorly. If you see from this statement, it is directed supro-posteriorly. And then the inferior facet directed infero-anteriorly. Okay, that is the features of the typical cervical vertebra that you have to know. And then the other features is the vertebral foramen. Okay, like I have mentioned earlier, it is large and triangular in shape. Okay. Okay, now we're going to move to the atypical cervical vertebra. We're going to discuss on the C1, and the other name for the C1 is the atlas. For the C1 or atlas, the superior articular facet, this is the superior articular surface or superior articular facet. It articulate, this part articulate with the occipital condyle. I hope you know where is the occipital condyle. And the weight of the head is transmitted to the vertebral column. Okay, so this is the features of the C1 atlas. Okay, you can see the atlas compared to the typical vertebra just now. Okay, and the other features of the cervical one vertebra or atlas, it does not have spinous process, so you cannot find any spinous process, okay, present on the cervical number 1. So it doesn't have a spinous process. But although it doesn't have a spinous process, it has a posterior tubercle. If you see here, this is the anterior posterior tubercle. This is the this is the posterior tubercle. This is the anterior tubercle. Okay. And beside that, there is also present of the groove for the vertebral artery. If you see from this picture, you can see there is a groove where, for the vertebral artery, where the vertebral artery is passing on. Okay. Now we're going to proceed to discuss on the C2, or the other name for the C2 is axis. Okay, for the axis, the superior articular facet, it articulate with the atlas. Okay, the superior articular facet here, it articulate with the atlas. Both the axis we have the atlas or C1. Okay, and then the other special features about the C2, we have the dens. If you see here, there is a projected part here, and this part is known as a dens. And this dens is held in position by the transverse ligament of the atlas. Okay, and the dens is pivot around which the C1 is rotated. Okay, the dens is the pivot around which the C1 is rotated. And then here, if you see here, we have a spinous process, okay? And the spinous process is large and bifid. That is the features of the C2 that you have to remember. Okay, and then now we're going to proceed with the C7, which is one of the example of the atypical type of cervical vertebra. And this C7 also known as a vertebra prominens. And what is the features of the vertebra prominens or C7? The spinous process, if you see here, okay, this is the spinous process of C7. It is very long and it is not bifid. Okay, it is very long and it is not bifid. So that is the features, okay, of the spinous process of the C7. And then beside that, it also has large transverse process. And the small foramen transversarium, there is a presence of the small foramen transversarium, but this small foramen transversarium, it does not transmit the vertebral arteries. That is the thing that you have to remember. Okay, now we're going to proceed with the next bone that present in the neck. Here, this is the hyoid bone. So what is the special about hyoid bone? The hyoid bone, it does not articulate directly with any other bone. If you see here, this is the hyoid bone. It does not articulate with any other bone. Where is the location of the hyoid bone? It is located at the level of the C3 vertebra. If you see here, this is the C3, cervical vertebra number 3. And then what is the component of the hyoid bone? It is consists of the body here and also the lesser horn and the greater horn. So this is the component of the hyoid bone that you have to remember. Now we're going to proceed with the next fact about the hyoid bone. So the hyoid bone, although it is not articulate directly to the other bone, but it is suspended from the stylet process here. If you see, this is the stylet process. It is suspended from the stylet process of the temporal bone by this ligament. This ligament is known as a stylohyoid ligament. And beside that, the hyoid bone also firmly bound to the thyroid cartilage. So this is the thyroid cartilage, okay, by this membrane. This membrane is known as a thyrohyoid membrane. And what is the function of thyroid bone? The function is for the attachment point for the anterior neck muscles. So this is the function. And the other function is to raise and lower the larynx during swallowing and speech. So that is the function of the hyoid bone. And then now we're going to proceed with the clavicle. So for the clavicle, it has two ends. If you see here, it has sternal end and also the acromion end. The sternal end is the medial end. The acromion end is a lateral end. The medial two-thirds of the clavicle, if you see here, the medial two-thirds, it is convex anteriorly. This is the superior surface, the part that you see from superiorly. And this is the inferior surface. And if you see on the superior surface, it has smooth surface. But the inferior surface, it has ridges. And also the groove. If you see here, there is a presence of the subclavian groove. Okay, and we also have the impression for the costoclavicular ligament here. And then we have the corner tubercle. We have the trapezoid line. So the inferior surface is rough compared to the superior surface smooth. Now we're going to proceed with the sternum. Okay, for the sternum, it has three parts. It's like a necktie. So it has the manubrium of the sternum. The second part is the body of the sternum. Okay, and the third part is the xiphoid process. But here we only interested with the manubrium of the sternum because it's part of bone that belong to the neck. So this is the manubrium of the sternum. So the characteristic of the manubrium of sternum, it has a jugular or suprasternal notch and also the clavicular notch. The clavicular notch is articulate with the clavicle. Okay, this is the standard angle. What is the standard angle actually? The standard angle of noise actually is a joint between the manubrium and also the body of the sternum, or manubrio-sternal joint. It is located opposite to the second pair of the costal cartilage. If you draw a line from front to the back, so it passing between the T4 thoracic vertebra number 4 and thoracic vertebra number 5. This is the standard angle, or manubrio-sternal joint. Now we're going to proceed to discuss on the fascia of the neck. Okay, for the fascia of the neck, so we have the superficial cervical fascia and also the deep cervical fascia. For the deep cervical fascia, we have three parts. We have the investing layer of the deep cervical fascia. You can see the green color. And then we also have the pretracheal layer, pretracheal fascia. And then we also have the prevertebral layer of the deep cervical fascia. So these are the components of the deep cervical fascia. Okay, for the superficial cervical fascia, what are the components? What are the structure that present in the superficial cervical fascia? So these are the content. We have the cutaneous nerve, we have the blood and lymphatic vessels, we have the superficial lymph node, and also the platysma muscle. So these are the content of the superficial cervical fascia. Okay, for the investing layer of the deep cervical fascia, okay, we're going to discuss one by one of the deep cervical fascia. Start to discuss on the investing layer of the deep cervical fascia. So if you see here from this picture, the green color line here, it represents the investing layer of the deep cervical fascia. So this layer or investing layer of the deep cervical fascia, it encloses the submandibular gland. Not only submandibular gland, it also encloses the parietic gland. Okay, if you see from the line there, green color line, okay, it's very obvious there. And this investing layer, layer of the deep cervical fascia, it continues posteriorly with the periosteum that cover the C7 spinous process. So it continues posteriorly with the periosteum covering the C7 spinous process. And also the ligamentum nipae. Okay, this is the superior view of the, you can see the investing layer of the deep cervical fascia that colored by the red color line there. You can see the one, that is the investing layer of the deep cervical fascia. The investing layer of the deep cervical fascia, it also invests, or enclose, okay, enclose the muscle. If you see here, we have the trapezius muscle at the back here. And then at the front here, we have the sternocleidomastoid muscle. So it crosses this muscle. For the superficial and lateral neck muscle, for the superficial and lateral neck muscle, we have three muscles here. We have the platysma muscle, sternocleidomastoid muscle, and for the sternocleidomastoid muscle, it has two heads, and the trapezius muscle. So these are the superficial and lateral muscle. So if you see here, this is the superficial neck muscle. So we have the platysma muscle that has been cut off here, and this is the sternocleidomastoid muscle. We have two heads. We have the sternal head. We have the clavicular head. The clavicular head is attached to the clavicle. Sternal head is attached to the sternum. And then we have the trapezius muscle. Then this is the platysma muscle. And then now we're going to proceed with the second part of the deep cervical fascia, which is the pretracheal layer of the deep cervical fascia. Okay, if you see there from this picture, if you see from this picture, you can see that the purple color line indicate the pretracheal layer of the deep cervical fascia. So you can see here, this is the purple line color. So that is the part that belong to the pretracheal layer of the deep cervical fascia. But here at the back there, we have the buccopharyngeal fascia. We're going to discuss further later. So the pretracheal layer of the deep cervical fascia, it is limited to the anterior part of the neck. Okay, it is limited to the anterior part of the neck. You can see it is limited only to the anterior part of the neck. But compared to the investing layer, the green color line there, it also covered the posterior part. But here, it only limited to the front part, anterior part. Okay, the purple color line there. And the pretracheal layer of the deep cervical fascia, it extends from the hyoid bone into the thorax. So you can see here, it extends from the hyoid bone. So this is the hyoid bone, extend from the hyoid bone, okay, into the thorax. And this pretracheal layer of the deep cervical fascia, it blend with the fibrous pericardium of the heart. It mix, combine with the joint, the fibrous pericardium of the. So that is the part that you have to remember. And if you move posteriorly, so you can see there is a purple color line there. It move, it continues posteriorly with the buccopharyngeal fascia. So it become a buccopharyngeal fascia in the back there. Okay, buccopharyngeal fascia of the pharynx. So just now we have discussed on the pretracheal layer of the deep cervical fascia. Now we're going to continue to discuss on this layer, the pretracheal layer of the deep cervical fascia. The pretracheal layer of deep cervical fascia also encloses the infrahyoid muscle, the thyroid gland, the trachea, and also the esophagus. So, so you can see here the green color line there. So it encloses the infrahyoid muscle. Okay. Not only that, it also form the trochlea of the digastric muscle. Okay, besides it includes the this muscle, the infrahyoid muscle, it also includes the thyroid gland. So you can see here, this is a thyroid gland. Okay, so this is the purple color, also belong to the pretracheal layer of the deep cervical fascia. The blue color line also belong to the pretracheal layer of the deep cervical fascia. Not only that, it also encloses the trachea here, and also the esophagus. Okay, so the pretracheal layer of the deep cervical fascia, it tether the two peri-omohyoid muscle. Okay, now we're going to proceed with the third part of the deep cervical fascia, which is the prevertebral layer of the deep cervical fascia. So it extends from the base of the cranium. If you see from the brown, okay, brown color line there, extend from the base of the cranium to the thoracic number 3, thoracic vertebra number 3. Okay, going down here. Okay. And then this in prevertebral layer of the deep cervical fascia, it fused with the anterior longitudinal ligament. Okay. Laterally, this prevertebral layer of the deep cervical fascia, it formed the axillary sheath, which surround the axillary vessels and also the brachial plexus. Okay. So if you see here, this is the anterior part, this is the posterior part. So you can this part actually we see from both. Okay. So if you see there, we have the this is the axillary sheet. Okay, so just now I have mentioned that this axillary sheet is formed by the pre-vertebral layer of the deep cervical fascia, and this axillary sheet it encircle or enclose the axillary artery and also the brachial plexus. Okay, pre-vertebral layer of the deep cervical fascia also form a tubular sheets that form the tubular sheet for the vertebral column. So this is the vertebral column, okay, at the back, and also the muscles. So it form a they enclose this muscle, the back muscle. Okay, now we're going to proceed to discuss on the carotid sheet. Okay, carotid sheet. Okay, this carotid sheet it extends from the base of the scalp toward the root of the neck. And anteriorly, if you see on the anterior part, it blends with the investing layer of the deep cervical fascia. And this is the investing layer of the deep cervical fascia. Sorry, this is the investing layer of the deep cervical fascia, the red color one line here. So it blend with the investing layer of the deep cervical fascia, and it also blend with the pretracheal layer of the deep cervical fascia, the purple color line here. And posteriorly, it blend with the prevertebral layer of the deep cervical fascia. What are the content of the carotid sheet? These are the content. We have the common carotid artery, we have the internal jugular vein, and we also have the vagus nerve. These are the structure that present in the carotid sheet. And beside that, we also have the deep cervical lymph node, carotid sinus nerve, and also the sympathetic nerve fiber that present inside the carotid sheet. Okay, now we're going to move to discuss on the retropharyngeal space. Okay, this, the white color line here is actually represent the retropharyngeal space. What is the retropharyngeal space? So it is a space that located between the prevertebral layer of the deep cervical fascia, colored by the brown color line here or orange color line, the same thing, and also the buccal pharyngeal fascia located anteriorly, and the prevertebral layer of the deep cervical fascia located posteriorly. So this space, the retropharyngeal space, is located in between these two parts. This prevertebral layer of deep cervical fascia, if you move, will be going upward here. So it is closed periodically by the base of the scalp, and laterally it is closed by the carotid sheet. But somehow it open inferiorly. If you see here, it open inferiorly, and it continues with the, and then it going down here into a superior mediastinum. So what is the function of the retropharyngeal space? It allows movement of the pharynx, of the esophagus, larynx, trachea in relative to the vertebral column during the swallowing. So it giving a space to allow the movement of this structure. Okay, we have the other structure that is very important here, which is known as the ala fascia. Okay, this is the part that you can see from superiorly or superior view. So this is the ala fascia. Okay, for the ala fascia, it forms a further subdivision of the retropharyngeal space. Actually, this is the retropharyngeal space. So it forms another subdivision of the retropharyngeal space. It is attached along the midline of the buccopharyngeal fascia. So if you see here, it being attached to the buccopharyngeal fascia in the midline, okay, from the cranium to the level of C7, okay. And then from this attachment, it extends laterally. If you see, if you follow my this arrow, it extends laterally to be attached to the carotid sheet on the other side. Okay. And then for the neck fascia, the carotid sheet and the pretracheal fascia, it communicates freely with the mediastinum inferiorly and cranial cavity superiorly. So you have to remember. Okay, carotid sheet and pretracheal fascia communicate freely with mediastinum inferiorly and cranial cavity superiorly. Now we're going to proceed to discuss on the region of the neck. So these are the region that present in the neck. So we have the sternocleidomastoid region. In the sternocleidomastoid region, we have the laser supraclavicular fossa. Then we also have the posterior cervical region. Here we have the suboccipital triangle. And then we have the lateral cervical region, which also known as a posterior triangle of the neck. We have the occipital, omoclavicular, or subclavian, or supraclavicular. And then we have the anterior cervical region, or the other name is anterior neck of the anterior triangle of the neck. And then we have the submental, we have the submandibular, we have the carotid and muscular. So you have to remember all of this region of the neck. Now we're going to discuss one by one of the region of the neck. So we're going to discuss, start to discuss on the sternocleidomastoid region. So the sternocleidomastoid region, okay, this is the sternocleidomastoid region, okay, reddish in the reddish color area here. So the content here, we have the sternocleidomastoid. If you make this part disappear, so you can see there is a sternocleidomastoid muscle, okay. And also, not only that, we also have a superior part of the external jugular vein. So this is the external jugular vein, the superior part of the external jugular vein. And we also have the great auricular nerve. If you see here, this is the great auricular nerve, and this is the transverse cervical nerve. So these are the structure or the content that presents in the sternocleidomastoid region. And then we also have the laser supraclavicular fossa in the sternocleidomastoid region. Okay, the content here, we have the inferior part of the internal jugular vein. For the posterior cervical region, for the content, okay, just now we have discussed on the sternocleidomastoid region. Now we're going to proceed with the posterior cervical region. So these are the content of the posterior cervical region. We have 4 muscle layers. We have the trapezius muscle, we have the splenius capitis muscle, we have the semi-splenius, semi-spinalis capitis and longissimus capitis muscle, and the 4 suboccipital muscle. And for the romi, we have the cutaneous branches of the dorsal romi of the cervical spinal nerve, dorsal ramus number C1, or the other name for this dorsal ramus of C1 is suboccipital nerve, dorsal ramus of the C2 that give rise to the greater occipital nerve, and dorsal ramus of the C3 that give rise to the third or least occipital nerve. This is the cutaneous branch of the dorsal romi, cutaneous. And then we also have the suboccipital triangle that lie deep to the superior part of this region in the posterior cervical region. Okay, this is the posterior cervical region. So just now I have mentioned all the muscle there. So if you see here, so this is the semi-splenius capitis muscle. This is the splenius capitis muscle. Okay, you can see this muscle clearly whenever you remove this trapezius muscle. And then to see the deep muscle, you have to remove these 2 muscles, and then you can see the other muscle there. Okay. And if you see here, okay, later we're going to discuss further. Okay, for the suboccipital muscle, just now the thing that I mentioned there, this is the deep muscle. Okay, so for you to see this suboccipital muscle, you have to remove these 2 muscles first. Okay, if you see here, I remove these 2 muscles, I cut these 2 muscles, and then I turn it upward so you can see these 4 muscles. Okay, we have the rectus capitis posterior minor muscle, we have the rectus capitis posterior major muscle, we have the obliquus capitis superior muscle, and also the obliquus capitis inferior muscle. Okay, so these are the muscle, suboccipital muscle, the deep muscle layer that you can see whenever you remove these 2 muscles. Okay. Okay, and then just now I mentioned that we have there is a presence of the suboccipital triangle in the posterior neck region. Okay, in the posterior cervical neck region, there is a suboccipital triangle. So for the boundary of this occipital triangle, supromedially, it is bounded by the rectus capitis posterior major muscle, which and then supplemented by the rectus capitis posterior minor muscle. Okay, supplemented by this muscle. This is the supromedially muscle. And then suprolaterally muscle, it is bounded by the uh, obliquus capitis superior muscle, or the other name for this muscle is superior oblique capitis muscle, the same thing actually. And then inferiorly, we have the obliquus capitis inferior muscle or inferior oblique capitis muscle, the same thing. Okay, so this is the boundary of the suboccipital triangle. Okay, why this suboccipital triangle is important? Okay, later we discuss further. Okay, on the roof part, okay, of this also suboccipital triangle, there is a dens on the medial side. There is a dens of fibrous tissue that covered by the semi-spinalis capitis muscle. So if you see here, this is the semi-spinalis capitis muscle that has been cut and reflected upward, okay, on the medial side. So there is a dense fibrous tissue covered by the semi-spinalis capitis muscle on the medial side. Laterally, we have the longissimus capitis muscle. Okay, if you see here, we have the longissimus capitis muscle. Okay. And sometimes we also have the splenius capitis muscle. Okay, and then for the floor, there is a posterior arch of the atlas. If you see here, this is the posterior arch of the atlas. And then we also have the posterior atlanto-occipital membrane, okay, on the floor of the suboccipital triangle. Okay, what are the content of the suboccipital triangle? Okay, we have the the Atlantic part, okay, the Atlantic part of the vertebral artery. If you see here, this is the Atlantic part of the vertebral artery. And then we also have the dorsal of the C1 or suboccipital nerve. You see here, this is the suboccipital nerve. And then we also have the suboccipital plexus of the brain. So these are the content of the suboccipital triangle. Then now we're going to proceed with the posterior triangle, okay, posterior triangle of the neck or lateral cervical region. Okay, posterior triangle of the neck or lateral cervical region, we have the occipital triangle, we have the supraclavicular or also omoclavicular or also subclavicular. And then for the anterior triangle or anterior cervical region, okay, we have the submental, we have the submandibular, we have the carotid, we have the muscular. Okay, so we're going to discuss on the posterior triangle first. So this is the posterior triangle. Okay, for the posterior triangle, the anterior boundary, it is bounded by the posterior border of the sternocleidomastoid muscle. If you see here, this is the posterior border of the sternocleidomastoid muscle. So there is the anterior boundary of the posterior triangle. And then posterior boundary, it is bounded by the anterior border of the trapezius muscle. So this is the anterior border of the trapezius muscle. And then inferiorly, we have the middle third of the clavicle. This is the middle part of the clavicle. So that is the boundary. Okay, the apex is actually where the sternocleidomastoid muscle and the trapezius muscle is meet on the superior nuclear line on the occipital bone. So this is the apex. Okay, this is the apex pointed part. Okay, where the sternocleidomastoid muscle and trapezius muscle is meet. Okay. And then the roof, it is covered by the investing layer of the deep cervical fascia, and on the floor we have the muscle that covered by the prevertebral layer of the deep cervical fascia. So these are the muscle that covered by the prevertebral layer of the deep cervical fascia. That is the regarding the posterior triangle of the neck. And inferiorly, there is a inferior belly of the omohyoid muscle, which divide the posterior triangle into occipital triangle. Okay, this is the yellow color area here is occipital triangle, And then we also have the supraclavicular triangle. So these are the content of this posterior triangle. Okay, we had the occipital triangle and also the supraclavicular triangle. Okay, so we have the nerve, we have the vessels, and also the lingual. So you can read on your own all the content that we present in the smaller triangle that present in the posterior triangle of the neck. We have the occipital triangles and also the supraclavicular triangle. So I just give a few number of example here. Okay, the nerve, we have the spinal accessory nerve present in the occipital occipital triangle, and we in the supraclavicular triangle we have the nerve to the step radius. Okay, you can read this table by your own, and then you have to remember this one. Okay, so now we're going to see one by one the nerve that present in the posterior triangle. Actually, where is the posterior triangle? Where, where is the location of this triangle? Sorry, where is the location of the nerve? Okay, where is the location of the nerve in this posterior triangle of the neck? So it is located between the investing layer and also the prevertebral layer of the deep cervical fascia. So it is located between these two layers. Okay, the two deep cervical fascia, between the investing layer and also the prevertebral layer of the deep cervical fascia. And then we have the spinal accessory nerve that present, okay, in the posterior triangle of the neck. Okay, if you see from this picture, this is the spinal accessory nerve. Okay, spinal accessory nerve. And then we have the branches of the cervical plexus. The branches of the cervical plexus here, we have the lesser occipital nerve. Okay, if you see from this picture, this is the lesser occipital nerve. And then we also have the great auricular nerve. Okay, this is the great auricular nerve. Okay, and then we have the transverse cervical nerve. Okay, this is transverse cervical nerve. And then we have the supraclavicular nerve. For the supraclavicular nerve, we have the medial, intermediate, and lateral. You see from this picture, we have the medial, we have the intermediate, and then we also have the lateral supraclavicular nerve. So these are the nerves present in the posterior neck triangle. Posterior triangle of the neck. And this nerve is located between the investing layer and also the prevertebral layer of the deep cervical fascia. Okay, the other nerve that also present in the posterior triangle of the neck, we also have the deep. We also have this nerve. Okay, if you see here, we also have this nerve. And this nerve actually is located deep to the prevertebral layer of the deep cervical fascia. This nerve is located between investing layer and also the prevertebral layer of the deep cervical fascia. And this nerve is located deep to the prevertebral layer of the deep cervical fascia. Okay, we have the dorsal scapular nerve, we have the long thoracic nerve, we have the ventral rami of the brachial plexus, we have the suprascapular nerve. If you see from this picture, you can see this is the suprascapular nerve. And then we also have the phrenic nerve. Okay, and this phrenic nerve actually is located deep to the prevertebral layer of the deep cervical fascia. Okay, now we're going to discuss on the phrenic nerve. So if you see here, this is the phrenic nerve. So it is originated from the C3, C4, and C5. What is the component of the phrenic nerve? It has mixed component between the motor component and also the sensory component. So the motor component is supplied to the diaphragm at the central part, and the sensory component is supplied to the diaphragm. Okay, not only to the diaphragm, it also supplied to the pericardium and also to the mediastinal pleura. Okay. And for the cause and relation of the right and left of phrenic nerve in the neck and also the mediastinum, you have to know. Okay, so you can see here, this is the phrenic nerve. Okay, so you can see the phrenic nerve is going downward. Okay, and it's supplied to the diaphragm. Okay, and then now we're going to discuss on the vessel that present in the posterior triangle of the neck. So what are the vessels that we have here? So we have the transverse cervical artery, we have the suprascapular artery, we have the occipital artery. If you see from this picture, this is the occipital artery that present in the posterior triangle of the neck. And we also have the third part of the subclavian artery. Okay, and then for the vein, we have the external jugular vein that present in the posterior triangle of the neck, and also the subclavian vein. Okay, for the subclavian artery, okay, for the subclavian artery, okay, this is the subclavian artery. Okay, okay, what are the muscles in the that present in the floor of the posterior triangle? Okay, so these are the muscles that present in the floor of the posterior triangle of the neck. So we have the splenius capitis muscle. Okay, we have the levatoscapular muscles. We have the scalenus medius muscle. Okay, and then we also have the scalenus posterior scalene muscles. Okay, so this is the posterior scalene muscles, and this is the middle scalene muscle. Okay. Okay, this is the posterior scalene muscle. This is the middle scalene muscle. Okay, or scalenus medius and also scalenus posterior. The same name actually. Okay, posterior scalene or posterior scalenus posterior. You can use either names, either two names. And then now we're going to proceed with the anterior triangle of the neck. Just now we have discussed on the posterior triangle of the neck. Okay. Okay, this is the area of the anterior triangle of the neck, the blue color dot line there. Okay, for the anterior triangle of the neck, the boundary anteriorly it is bounded by the median line of the neck. Okay, if you see it here, this is the anterior boundary. Okay, median line of the neck. And then posteriorly, the posterior boundary by the anterior border of the sternocleidomastoid muscle, anterior border of the sternocleidomastoid muscle, and then superiorly by the inferior border of the mandible. Okay, superiorly by the inferior border of the mandible. This is the inferior border of the mandible. Okay, this is the superior boundary. Superior boundary, okay, posterior boundary, and anterior boundary. Okay, so we have three boundary: the anterior boundary, posterior boundary, and superior boundary. And then for the apex is toward the jugular notch. Okay, toward the jugular notch. And then for the roof, it is covered by the subcutaneous tissue that contain the platysma muscles. And for the floor, we have the pharynx, larynx, and also the thyroid gland that are present in the floor of the anterior triangle of the neck. Okay, for the anterior triangle, we're going to discuss further. Okay, so anterior triangle, if you see the anterior and posterior belly of the digastric muscle. Okay, if you see here, this is the digastric muscle. Okay, anterior belly and also the posterior belly. Okay, posterior belly and anterior belly. The anterior belly and posterior belly of the gastric muscles, and also the body of the hyoid muscles, and also the superior belly of the omohyoid muscles. It divides the anterior triangle here, anterior triangle, into a four smaller triangle. So we have the submental, okay, which is a unpaired triangle, and we have the submandibular, okay, this is the paired triangle, or the other name for the submandibular triangle is a digastric triangle. And then we have the carotid, okay, and then we also have the muscular triangle or omotracheal triangle. Okay, for the submental triangle, so the content here we have the submental lymph node. So this is the submental triangle. We have the submental lymph node. For the content of the submandibular triangle, so these are the content in the anterior part, on the posterior part. So you can read on your own. We have the salivary glands in the anterior part, okay, and the vessels and the nerve, muscle, node, and all the things that you can read on your own. Okay. And then on the posterior part, we also have the salivary gland and the vessel, the nerve, and the muscles here. Okay. Just now, if you see from this picture, on the anterior part, right? So the facial artery and the vein. Okay. If you see here, so this is the facial artery. So it passing through the here the anterior part of the submandibular triangle. Okay. And then submental artery, we also have the submental artery. If you see here, this is the submental artery, okay, at the anterior part of the submental triangle. And we have the mylohyoid vessels. Okay. Okay, this is the mylohyoid vessel. Okay, but you have to going downward here. Okay, and then the nerve. Okay, for the nerve, we have the hypoglossal nerve. Okay, hypoglossal nerve, which is the 12th cranial nerve. Okay, if you see from this picture here, this is the hypoglossal nerve. Okay, going to the anterior part. Okay, and then we also have the nerve to the mylohyoid. And then the muscle here, we have the stylohyoid muscle. Okay, so these are the component that we have in the anterior part of the submandibular triangle. And then going backward, okay, going backward. So on the posterior part, we have the external carotid artery. If you see here, this is the external carotid artery. The external carotid artery is passing through the posterior part of the submandibular triangle. And then we also have the internal carotid artery. This is the internal carotid artery. And then we have the vagus nerve. Okay, the vagus nerve that passing into the posterior part of the submandibular triangle. Okay, thank you. And then for the content of the carotid triangle, so just now we have discussed on the submental triangle, submandibular triangle, and then now we're going to proceed with the carotid triangle. So these are the content of the carotid triangle. Okay, on the for the arteries we have the common carotid artery, internal carotid artery, and also the external carotid artery. Okay, and the other part you can read on your own. The vein here we have the internal jugular vein. Okay, you can read on your own here. And then for the content of the muscular triangle or omotracheal triangle, so these are the content. So it contains mainly the content for this muscular triangle is a infrahyoid muscle and also the gland. So we have the sternocleidomastoid muscle, sternothyroid muscle, thyroid muscle, and also homohyoid muscle. This is the infrahyoid muscle that present in the muscular triangle. Okay, so this is the nerve that supply to this muscle. And then the gland, we have the thyroid gland that present in the muscular triangle, and also the parathyroid gland. Okay, so the thing that you have to remember is the ansa cervicalis. So later we're going to discuss this one. The ansa cervicalis, it supply the infrahyoid muscle in the anterior triangle except the thyrohyoid muscle, except this muscle, thyrohyoid muscle. Okay, so the other infrahyoid muscle is supplied by the ansa cervicalis, but thyroid muscle is exception because it is via the 12th cranial. C1 via the 12th cranial. Okay, now we're going to discuss on the muscle that we have in the anterior triangle. We have the suprahyoid muscles and then infrahyoid muscles. So suprahyoid muscle, we have the mylohyoid muscles, glenohyoid muscles, stylohyoid muscle, the gastric muscles. Infrahyoid muscle, we have the sternocleidomastoid muscle, omohyoid muscle, sternothyroid muscle, and also thyroid muscle. So this is the nerve that supply to each of the muscle. So this infrahyoid muscle is innervated by the ansa cervicalis except this thyroid muscle because it's received the C1 here through the 12th cranial nerve. So this is the suprahyoid muscle. This is the infrahyoid muscle. Okay. If you see here, this is the infrahyoid muscle. We have the omohyoid muscle, stenohyoid muscle, sternothyroid muscle, and thyroid muscle. For the suprahyoid muscle, we have the glenohyoid muscle. We have the stylohyoid muscle. We have the sorry. This is the digastric muscle. Okay, digastric muscle. Okay, we have the stylohyoid muscles and also the mylohyoid muscle. Okay, these are the suprahyoid muscle. Okay, so you have to remember this. Glenohyoid muscles, digastric muscles, stylohyoid muscles, and mylohyoid muscle. Okay, we have hyoid muscle here, suprahyoid muscle, and infrahyoid muscle. And then what are the arteries that present in the anterior triangle of the neck? We have the common carotid artery. So the common carotid artery is located in the anterior triangle of the neck, and also the terminal branches. Terminal branches. We have the internal the terminal branches of the common carotid artery. We have the here. If you see here, this is the this is the external carotid artery, and this is the internal carotid artery. This is the terminal branches that present in the anterior triangle of the neck. Okay, for the internal carotid artery, it does not have branches in the neck. So that is the thing that you have to remember. The terminal branches of the common carotid artery here for the internal carotid, it does not have a branches in the neck. ICA, ICA. For the external carotid artery, it has a terminal branches. The terminal branches here we have the maxillary artery and also the superficial temporal artery. Okay, this is the terminal branches of the external carotid artery. And the other branches that also branch from the external carotid artery is the ascending pharyngeal artery. Okay, we have the occipital artery. We have the posterior auricular artery. If you see from this picture, this is the posterior auricular artery. This is the occipital artery. Okay, and then we have the superior thyroid artery. Okay, this is the superior thyroid artery that branch from the external carotid artery. And then we have the lingual artery, and then we have the facial artery. You see here, this is the facial artery. Okay, this is the lingual artery. So this is the artery that branch off from the external carotid artery. Okay, thank you. Okay, just to repeat back what I have mentioned, you can see on your own. And then the vein that present in the anterior triangle of the neck, we have the internal jugular vein, we have the tributaries, the branches or the tributaries of the internal jugular vein. We have the pharyngeal vein, we have the facial vein, we have common facial vein, we have the lingual vein, we have the superior and inferior thyroid vein. And then the nerve that present in the anterior triangle of the neck, we have the glossopharyngeal nerve, okay, the ninth cranial nerve. And the branches of the glossopharyngeal nerve are also present in the anterior triangle of the neck. And then we also have the vagus nerve and the branches of the vagus nerve. Okay, we have the pharyngeal branches of the vagus nerve. We have the supralaryngeal branches of the vagus nerve, which further divided into external and internal laryngeal nerve. So these are the nerve that present in the anterior triangle of the neck, glossopharyngeal nerve and vagus nerve, and also the several branches that arises from this particular nerve. And then we also have the spinal accessory nerve. Okay. And then we also have the hypoglossal nerve. Okay, 12 cranial nerve. And then we also have the ansa silicaris that supply to the infrahead muscle, with the exception of the thyroid muscle. And sympathetic chain posterior to the located posterior to the carotid chain. And the transverse cervical nerve, okay, from the C2 and C3 that supply to the skin. Okay. Okay, you can see here, whenever you dissect there, you can see all the structure that we have discussed just now. Okay, this is the superficial dissection of the anterior neck. This is a deep dissection of the anterior triangle of the neck. And this is a dissection of the anterior neck. Okay. Okay, now we're going to discuss on the cervical plexus. Okay, for the cervical plexus, it is formed by the ventral rami of the C1 to C4. The cervical plexus, it lies anterior to the origin of the levator scapula and the middle scalene muscles. And the cervical plexus is covered anteriorly by the prevertebral layer of the deep cervical fascia, and it's covered superficially by the sternocleidomastoid muscle. Okay, this is the cervical plexus. So you have to know the where it's located, okay, and how it is formed, and the covering of this cervical plexus. And then for the cervical plexus, now we're going to proceed to discuss on the deep or muscular branches of the cervical plexus. The connection of the ventral rami include the neural communication from the cervical sympathetic ganglia, and that supply to the long muscles of the neck, and also to the head, to the neck, levator scapula, and also the middle scalene muscles. Okay, C1. Okay, C1. Okay, and sometimes C2. Okay, root number C1 and C2. It travel initially with the 12th cranial nerve. Okay, and it formed the superior root of the ansa cervicalis. So we'll show you the picture. Okay, so this is the ansa cervicalis. Okay, so you can see here, this is the ansa cervicalis. Okay, this is the ansa cervicalis. Okay, so just now that I mentioned early, okay, this is the C1, this is the C2. Okay, okay. If you see from this picture, okay, this is the ansa cervicalis. So this hypoglossal nerve, if you see from the early part of my explanation just now, okay, it travel with the 12th cranial nerve. Okay, it travel with the 12th cranial nerve. If you see here, this is the hypoglossal nerve. It travel with the 12th cranial nerve. So this is the C1, nerve root of the C1. Okay, initially it travel with the 12th cranial nerve. Okay, same thing you can see here. This is the C1, so it travel with the 12th cranial nerve. And then this part, the C1 and sometimes C2, it form the superior root. Okay, this is the superior root. This is the superior root of the ansa cervicalis. Okay, this is the superior root of the ansa cervicalis. This is the inferior root of the ansa cervicalis. So the superior root is contributed by the C1 and sometimes C2. Okay, you can see there. And then we go back here. The C1 is it innervate the thyroid muscle and also the head muscle. Okay, for the C2, how it formed the inferior root. So this C2 and C3, it formed the inferior root of the ansa cervicalis. If you see from this picture, this is more clear. C2 and C3, it contribute to the formation of the inferior root of the ansa cervicalis. So it formed the complete loops of the ansa cervicalis. Okay, inferior root, superior root. Okay, and then this inferior root of the ansa cervicalis, it form a connection with the superior root. Okay, whenever it connect with the superior root, it form the complete loops of the ansa cervicalis. So that is regarding the explanation of the what is the ansa cervicalis. So the ansa cervicalis is supply the infrahyoid muscle with the exception of the thyroid muscles. Okay, you have to remember that one. And other deep motor fibers, okay, that also branch from this deep muscular branch of the cervical plexus. We have the phrenic nerve, okay, that arises from the C3 to C5, and then prevertebral muscle that supplied to the by the C2, okay, and C3 and C4, okay, nerve root, okay, supplied to the levator muscle of the scapula. This is the deep motor fiber that arises from the deep of the cervical plexus or muscular branches of the cervical plexus. Deep branches or muscular branches of the cervical plexus. Okay, if you see here, you can see this is the phrenic nerve. Okay. Okay. So the ansa cervicalis, the same thing that I have explained just now, is a nerve loop. Okay. Okay, the nerve loop. We have the superior root and also the inferior root of the ansa cervicalis. Okay. Ansa cervicalis, the same thing. The ansa cervicalis is supplied to the infrahyoid muscles, except the thyroid muscle. Okay, that is the deep muscular branches of the deep cervical plexus. Okay, now we're going to discuss on the cutaneous branches of the cervical plexus. Okay, the cutaneous branches is applied to the skin. It's formed by the simple loops between the C2 to C4. Okay, for the cutaneous branches, okay, we have the laser occipital nerve, we have the great auricular nerve, we have the transverse cervical nerve, we have the supraclavicular nerve. And then supraclavicular nerve, we have the medial, intermediate, and lateral. I think I have shown you in the first picture. And the laser occipital nerve, okay, this is the laser occipital nerve, okay, from the C2 and C3, nerve root of C2 and C3. It's applied to the scalp, to the area of the skin of the scalp behind the ear. You can see here, behind the ear. Great auricular nerve, skin over the parietic gland. So this is the great auricular nerve. Okay, it's applied to the skin over the parietic gland. Okay, most of the auricle of the ear also supplied with this great auricular nerve. Okay, and the skin over the mastoid process. Okay, this is the area of the mastoid process. Okay, and the transverse cervical nerve. So this is the transverse cervical nerve. It's supplied to the most anterior portion of the neck. And supraclavicular nerve, okay, this is the supraclavicular nerve. Okay, we have three branches just now. We have the medial, we have the sorry, so we have the three branches just now. So for the medial, it supply to the skin over the anterior portion of the clavicle and the sternoclavicular joint. So this is the medial. Okay, it's applied to the anterior portion of the clavicle, and also the sternoclavicular joint. And here we have the intermediate. Okay, this is the intermediate branch of the supraclavicular nerve. It supplies to the skin over the outer part of the deltoid muscles. Okay, and also the clavicular head and also the pectoral muscle. And for the lateral, okay, for the lateral, it's applied to the skin of posterior portion of the upper posterior portion of the shoulder. This is the lateral supraclavicular nerve. Okay, for the root of the neck, okay, the boundary for the root of the neck laterally, it is bounded by the first rib and also the costal cartilage. Anteriorly, it is bounded by the manubrium of the sternum, and posteriorly by the body of the T1 thoracic vertebra number 1. For the artery, these are the artery, okay, that presents. Okay, we have the brachiocephalic trunk, we have the right and left subclavian arteries, we have the branches of the subclavian artery. And then these are the vein, okay, we will have. Okay, you can see on your own. And the nerve, okay, we have the vagus nerve, we have the right recurrent laryngeal nerve, we have the left recurrent laryngeal nerve. Okay, on the right and also the left. These are the branches of the vagus nerve. Okay, recurrent laryngeal nerve. Okay, and then now we're going to move to the next one, which is the phrenic nerve. Okay, for the phrenic nerve, it is located anterior to the scalenus muscle, anterior muscle, passes between the subclavian artery and the vein under the prevertebral layer of the deep cervical fascia. Okay. And then for the sympathetic trunk, we have the superior cervical ganglia, we have the middle cervical ganglia, and also the inferior cervical ganglia. And for the thoracic duct, okay, if you see from this picture, so we have the green color line here. This is the thoracic duct. It passes superiorly along the left border of the esophagus. Okay, passes superiorly along the left border of the esophagus and arches laterally in the root of the neck. Okay, it enters the left brachiocephalic vein. Okay, if you see here, so it passes superiorly along the left border of the esophagus and arches laterally in the root of the neck, and then it enters the left brachiocephalic vein at the junction of the subclavian vein and also the internal jugular vein. Okay, So it enter into the brachiocephalic gland. Okay, so what are the viscera, the organ that present in the neck? Okay, this one will be covered in the respective block. Okay, now we're going to discuss on the joint that we have in the neck. We have the atlanto-occipital joint. Okay, what are the important component of the atlanto-occipital joint? The atlanto-occipital joint is a synovial joint of the condyloid type. There is no presence of the intervertebral disc, uh, the joint between the atlas and also the occipital bone. And the movement that happen here is a flexions and also the extension and sideways tilting of the head. The atlanto-occipital joint, it has a thin, loose articular capsule. And the ligament here, we have the atlanto-occipital membrane. Okay, we have the anterior atlanto-occipital membrane and also the posterior atlanto-occipital membrane. And the function, the function of the ligament here is to connect the axis and the occipital bone are also involved. Sorry, functionally, the ligament connecting the axis and also the occipital bone are also involved. Okay, functionally, the ligament connecting the axis and the occipital bone are also involved. Okay, the atlanto-occipital membrane. Okay, this is the anterior atlanto-occipital membrane. Okay, the other picture you can see here, this is the posterior atlanto-occipital membrane. Okay, this is the two atlanto-occipital membrane that I have discussed just now. So from the anterior and posterior, so it extend the atlanto-occipital membrane. It extend from the anterior and posterior arches of the C1 to the anterior and posterior margin of the foramen magnum. Okay, so you can see here this anterior atlanto-occipital membrane. It extend from the anterior arches of the C1 to the anterior margin of the foramen magnum. And then here for the posterior atlanto-occipital membrane, it extends from the posterior arches, okay, posterior arches of the cervical number 1 to the posterior margin of the foramen magnum. And the function of the atlanto-occipital membrane is to prevent the excessive movement of the head. Okay. And then now we're going to move to the next joint, the atlanto-axial joint. Because now we have discussed on the atlanto-occipital joint, between the cervical number 1 and also the occipital bone. But here between the atlas and also the axis bone. For the atlanto-occipital joint, it is a synovial joint. You can see here, this is synovial joint. There is no intervertebral disc involved here. There is no intervertebral disc present, and the movement happen here is actually rotation, rotate. And then there are three atlantoaxial articulation that involved here. Two lateral atlantoaxial joint, okay, two atlantoaxial joint. So if you see here, we have two atlantoaxial joint, and then we have the this atlantoaxial joint actually is a zygapophyseal joint of the gliding type. Okay, between the C1 and also the C2. But we have one median atlantoaxial joint between the dens of the C2 and C1. This is actually is a pivot joint. Okay, pivot joint. So this is the dens. So this is the dens of the C2. Okay. For the cruciate ligament, we have the cruciate ligament. The cruciate ligament is like a T in shape. It's like a cross. Okay. The cruciate ligament is a transverse ligament of the atlas, transverse ligament of the atlas between the tubercle of the medial side of the lateral mass of the atlas. Okay, and it holds the dens of the axis against the anterior arch of the atlas. Okay, so it holds the dens of the axis. Okay, axis here, it holds the dens of the axis against the anterior arch of the atlas. So this is the atlas. So this is the function of the transverse ligament. Okay, this is the transverse ligament. Okay, so this transverse ligament is attached between the tubercle of the medial side. Okay, we have the tubercle on the medial side of the lateral mass of the atlas. Okay, so this is the transverse ligament, part of the cruciate ligament. Okay, and then we have the longitudinal band. So this is the longitudinal band from the transverse ligament to the occipital bone. Okay, from the transverse ligament here to the occipital bone. Okay, from the transverse ligament to the occipital bone superiorly, and then to the body of the C2 inferiorly. So because we have the superior longitudinal band and also the inferior longitudinal band. Okay, two parts. And then we also have the tectorial membrane, ala ligament, and the ala ligament is a pair in number. And we have the median apical ligament of the dense and longitudinal component of the cruciate ligament. Okay, this is the tectorial membrane. Okay, the tectorial membrane actually is a superior continuation of the posterior longitudinal ligament. Okay, from the body of C2 to the internal surface of the occipital bone. Okay, from the body of C2, this is the tectorial membrane. Okay, to the internal surface of the occipital membrane. So this is the internal surface of the occipital bone. Okay, this is the part of the tectorial membrane. So it continues from the posterior longitudinal ligament. This is the posterior longitudinal. It's just a long the continuation of the this ligament, posterior longitudinal ligament, and then later it become a tectorial membrane. Okay. And then for the ala ligament here, we have the ala ligament. It attached from the side of the dens to the lateral margin of the foramen magnum. You see here, this is the lateral margin of the foramen magnum. Okay. And the function of the ala ligament, it prevents the excessive rotation of the atlantoaxial joint. Okay, this part you can read on your own on the clinical side of this this lecture. Okay, on how you test the action of the trapezius muscle and also the sternocleidomastoid muscle. And we also have the torticollis, okay, where the torsion or twisting of the neck and elevation of the chin due to the shortening of the sternocleidomastoid muscle. Usually it happens in the tuberculous adenitis that result in the blind. Okay, thank you.